Hello and good evening. I am Umudu Gajaga and this is Qtv News coming to you live from our studios on Caraba Avenue. Thank you for joining us. And now here are the main local and international news headlines. Hundreds of Gambians in Fonyi Kansala have fled their villages around the border with Casamance following heavy gunfire during clashes between Senegalese soldiers and the MFDC rebels, in which 2 Senegalese soldiers were killed. Over 200 countries have collaborated and MRC the Gambia to produce data on antimicrobial resistance, which causes 700,000 deaths per year. At its annual data presentation and award ceremony, held on Thursday, the Bundung Maternal and Child Health Hospital registered 3 maternal deaths in 2021. We speak to experts and individuals about cybersecurity, which has become a big issue globally, especially in Africa, where cybersecurity measures appeared weak. In international news, Malawi's President Lazarus Chakwera has released a statement confirming the appointment of several new ministers after the old cabinet was dissolved over corruption scandals. More in this report. Those were the main news headlines, and now the news in detail. Welcome and thank you very much if you're just joining us. This is QTV News and I am Umudu Gajaga. Hundreds of Gambians in Fonyi Kansala have fled their villages around the border with Casamance following heavy gunfire during clashes between Senegalese soldiers and the MFDC rebels in Casamance. Babukar C visited Fonyi and this is his special report.
8 Senegalese soldiers have gone missing on Monday after a clash with Casamance rebels in the border area with Gambia. The Senegalese army says the missing soldiers are likely held hostage by the MFDC rebels in Casamance. We visited the Fonyi Kansala region to gain first-hand knowledge of the situation. In Bujinga, we found more than 200 internally displaced people, mainly women, children, and the elderly. A village elder, Mustafa Bojang, says they are doing all they can to support the displaced people and call on the government to help solve the problem.
The Senegalese soldiers occupying our region should leave. I don't have much to say other than to call on the Gambia government to evacuate the Senegalese from our area. They brought us no good except fear and stress.
The displaced people are being cared for by the Gambia Red Cross and the community of Bujinga, led by the councillor Kadi Baji. She told us that feeding these people is a huge task and they might run out of cash soon if the government does not intervene. She was also concerned about the closure of the school in the area as students were preparing for their exams.
Grade 9 exam.
This is really disheartening and sad. Those preparing for the grade 9 exams are here with us, and I am not sure if they are mentally stable to sit for any exams. Equally, their teachers are all gone. They run for their lives. Worst of all, the students are terrified by the presence of these soldiers in our region because whenever they are going to school, they run back when they see soldiers on patrol carrying heavy weapons.
From Bujinga, we headed to Kampant, expecting to reach Kappa, where the rebels are believed to have a base.
Well, after 2 hours of negotiations with the rebel, they have denied us entry to this point, going to Kappa Basic Cycle School, which is just 3 kilometers from here. Well, according to them, this is the no-go area, and as we could see from this barricade that they've put here, we are not allowed entry. And this, according to the information we have gathered, the rebels have occupied a village called Kappa, which is just 3 kilometers from here. After fighting with the Senegalese armed forces, in Balen, they've moved some kilometers into the Gambian territory.
However, we met the vice principal of Kappa Basic Cycle School, Omar ID Kinte, who was with the school children when the incident happened on Monday. Mr. Kinte said they have to disperse immediately when they heard heavy gunshots and explosions.
The schools that were affected in this area, Kappa, my school, Atambakunda, Bunubor, all those schools are seriously affected because even yesterday a teacher from Tambakunda also called me to discuss about the issue. But as at now, all the children are presently, sitting down, and teachers also, they evacuated the places because of the fear. And because of this fear, that is why, we are at high risk. And that is why teachers, even at our school, are demanding for 100%, risk allowance.
Others who also witnessed the incident explained to us what they saw. And so Sanyang worked for the Gambia Food and Nutrition Association, implementing the UNHCR programs in the country. He explained how he managed to reach Balen village on Monday and met the alcalde of the village.
He saw a vehicle, a truck, loading timber with high speed, running towards Kasama's end. Then suddenly he saw the pickup belonging to the Senegalese soldiers also casing it. So from there they started hearing gunfires. Then they saw people fleeing from the communities Balen and Karunor to their community. I stayed up to around 2 in Kappa. We got the information again that the rebels have entered Kappa. That's how I took the back road to Bujinga and went back to my house in Buyam.
On our way back, we spoke to the NDMA Regional Coordinator for West Coast Region, Binta C. Jadama, who explained what the agency is doing to support displaced people.
As for the first 24 hours, we were able to register 700 IDPs that were in different locations, mainly in Mandina, Bujinga, Arangalen, Bajagar, and so on. That was just a rough scan. It didn't include the number of households. We were just counting per head. But the next step is that I guess you'll meet my team in the field. They are now doing house-to-house assessment to gather a number of families that are now in Bujinga, that are in Bajagar, that are in Mandina, Burok, and all those communities on the main highway. The report I sent indicated the need for urgent feeding issues. Bujinga, they complain that there are community assistants, there are people assisting them. But for government, the food intervention, we are hoping to do either tomorrow.
The Gambians affected by the fight are led by Honorable Musa Amul Nyasi, the National Assembly member for Fonyi Councillor. Honorable Nyasi has been working tirelessly to restore peace and order in the region.
I wasn't going to fight with them, but I was going to explain myself to them that where the instability occurred, which is the border villages, the Balens, the Funtangs, the Kappas, all fall within my constituent. I am who I am today as a sitting National Assembly member because of their votes. We had a lot of interactions, a lot of conversation with them, coupled with calling the authorities, particularly within the security forces, to give them first-hand information on what is happening. I went further to call the NDMA as well, because somebody who left his house in that situation, you don't expect him or her to carry anything with him or her. So I discussed with them to show them the need for their urgent and immediate intervention.
A press release issued on Tuesday by the Information and Relations Directorate of the Senegalese Army explains that the clash of January 24th in Buyam in southern Gambia along the Kampant Kappa Cambogel axis when the military launched an operation to stop the illicit trafficking of logs from Casamance to the Gambia. The Senegalese Army claimed 2 of their soldiers died during the clash and that they killed 1 rebel and captured 3. The Senegalese Army press release indicates that during the last 5 months, 77 trucks illegally transporting logs from Casamance in southern Senegal have been immobilized by the 5th Senegalese detachment deployed with the Economic Force in the Gambia. The press release concludes, quote, "The Senegalese Army will continue its efforts to find the missing soldiers and defend the preservation of the forests," end of quote. Senegal's President Macky Sall issued a Twitter message sending condolences to the families of the deceased and wishing the injured a speedy recovery. The Gambia government, through the presidential spokesperson Ibrahima Sankare, also released a statement saying a presidential task force has been created to investigate the matter. Babukar C, QTV News.
Some disturbing news there. Antimicrobial resistance, AMR, has become a global phenomenon in public health. Over 200 countries have collaborated to produce data on AMR. Ajibintu Drame spoke to the head of MRC, the Gambia Clinical Services, and a microbiologist on the effect of AMR on public health.
Antimicrobial resistance, AMR, refers to the ability of microorganisms to withstand antimicrobial treatments. The overuse or misuse of antibiotics has been linked to the emergence and spread of microorganisms, which are resistant to antibiotics, rendering treatment ineffective and posing a serious risk to public health. In recent years, AMR has become one of the biggest health threats around the world, yet most people know very little about it. 700,000 deaths per year are caused by AMR, and by 2050, that number is estimated to reach 10 million worldwide, according to the 2015 review on AMR. Dr. Karen Forrest, Head of Clinical Services at MRC Unit The Gambia, explains.
They estimate between 900,000 and 1.7 million deaths occur because of resistance each year as the primary cause of death. That's actually more than the total deaths from HIV and malaria in the world every year.
Global partnerships involving 204 countries and the Medical Research Council participated to seek information and compile data about the impacts of AMR.
Primarily is when people take antibiotics that they don't need to take. So that might be because they have a viral illness, an antibiotic can't treat a virus. It might be because they don't even have an infection at all and they take antibiotics. It can also be caused when people who raise animals give antibiotics to their animals to help them grow better, and then those bugs become resistant and we can be infected as human beings.
Dr. Forrest says easy access and misdiagnosis of antibiotics on our disposal is a huge factor in the Gambia, and measures should be put in place to control this global problem.
I mean, I think in a society like ours, where people can walk into a shop and buy antibiotics, it's very important that we raise awareness. We need to raise awareness also because when people come to see a doctor, if you say to them, the illness you have is going to get better without medication, they don't go away happy. They think that you as a doctor haven't taken good care of them, isn't it? So we need to raise awareness in the community that not every infection, not even every bacterial infection needs antibiotics. Certainly not all infections are caused by bacteria, and viral infections don't need antibiotics. And sometimes the symptoms we have are not due to infection. So if you have a cough, it could be because of an allergy, for instance, and an antibiotic won't help that.
When someone dies from an antibiotic-resistant infection, there is no certification stating that they died from the infection because they were resisting antibiotics. People just see that it was from an infection, according to an article by Giving Compass. It is the leading cause of death globally, particularly in sub-Saharan Africa, mainly affecting children under 5. Safiatou Dabo, Lead Diagnostic Microbiologist, MRC The Gambia, explains.
It's important that the government takes the lead in this. We have in the past provided support, and we were actually able to identify, antimicrobial resistance, an outbreak that happened in the hospital, which was due to antimicrobial resistant bugs.
It is significant to know local data about the Gambia, Safiatou Dabo says. MRC The Gambia and the government need to collaborate. AMR facilities are limited in sub-Saharan Africa, and it involves expertise, resources, and capacity building. It takes more than creating awareness to tackle the deadly antimicrobial resistance. Ajibintu Drame, QTV News.
The Bundung Maternal and Child Health Hospital registered 3 maternal deaths in 2021. The information was revealed on Thursday during the hospital's data presentation and award ceremony to recognize the efforts of the staff of the maternal unit. Abibatu Sise has more.
Maternal and child health care is an important public health concern, as maternal mortality is among the leading cause of death in women and children. The event aims to provide data and statistics on the achievements registered by the Bundung Maternal and Child Health Hospital in 2021, as well as challenges and the way forward in reducing maternal mortality in the country. Amin Jai, a midwife, reveals that the maternal unit has 46 staff, including nurses, midwives, and 5 medical doctors. She further stated that the hospital has made significant progress in maternal and child care in the past years.
In 2021, a total of 5,712. There was significant increment in the total number of deliveries in 2021 compared to 2020. Going further, out of the total deliveries, normal delivery in 2020 constituted 3,694 compared to 4,928 in 2021. Then mode of deliveries for vacuum in 2020 total to 130 compared to 240 in 2021. And then cesarean section in 2020 total to 379 compared to 525 in 2021.
Aminjai added that the COVID-19 pandemic caused a decline in women opting for medical care in 2020. Despite this challenge, she says the trend has changed in 2021 and the hospital has improved in reducing maternal death.
We heard from the previous deliberation that in 2020 we had 6 maternal deaths. 2023 and 2021 we had 3 maternal deaths. This is showing a 50%, half-way reduction of maternal death. And we hope and pray and promise ourselves that we will continue to maintain this 50% reduction as the years come.
According to midwife Njai, there has been an increase in the number of deliveries by women who registered in other health facilities but opted to deliver in Bundu Maternal Hospital.
In 2020, of the total delivery, 27% of women registered from other facilities delivered in Bundu, compared to 35% in 2021. So, and this, we anticipate that the trend will just continue to rise and rise and rise. Every year we will expect more women registered in other facilities and then opting to deliver in Bundung Hospital.
The authorities revealed that the hospital lacks the space for neo and postnatal admissions, has few medical officers, poor roads for ambulances, and for maternal referrals, amongst other challenges. Nurse attendants, midwives, doctors, and orderlies were given awards for outstanding performance during last year. Majula T. Kinte, head of the maternal unit, explains the importance of the event.
Awarding my staff is like, I am as the head of department, motivating your staff should be your #1 goal, to make sure that you keep them on their toes to do what is expected of them, to be on the right channel, to make sure patients are happy when they are leaving your unit.
The Bundu Maternal and Child Health Hospital targets reducing maternal mortality and stillbirths in 2022 and advocates for more medical officers, especially gynecologists. For QTV News, I am Abibatu Sise.
We'll now take a short commercial break, and when we return, we still have some more local and international news stories. Do stay tuned.
With so many things to do in a single day, it's important to have a network you can trust. When there's family and friends to connect with and business calls to make, you need a network that is reliable and fast. Talk longer, browse faster, go farther, and roam wider. When your network is solid, the world is your oyster. QCell, your trusted network in the Gambia.
Welcome back, and thank you very much if you're just joining us. This is QTV News. Cybersecurity has become a big issue globally, especially in Africa, where cybersecurity measures appear weak. Unfortunately, in the Gambia, banks, public and private institutions and individuals allegedly fall prey to hackers almost every day. Fatou C. Sanyang engaged experts and individuals about this phenomenon, and this is her report.
Cybersecurity is the protection of confidential and private information that is kept in an electronic form. It is a measure of security data which is usually personal and private. The aim is to make this information inaccessible to unauthorized persons. Confidential and private information includes a person's banking details, medical records, social media accounts, amongst others. Hackers seek to exploit vulnerabilities. Thus, there need to be solutions to remedy the situation. Ibrahim Akebi Sanko, a journalist and a teacher, fell victim to scammers and explains how it happened.
It affected me greatly because I'm a blogger, so and other people also rely on me on information to share, especially sport information. And again, like I said, I also manage other Facebook pages, charitable Facebook pages, and some even sporting Facebook pages. I manage about more than 4 players. As we speak, all those players lost their Facebook Facebook pages, which it has more than 5,000 likes, and it reaches to more than 100,000 people per week. still we cannot recover all those accounts.
Amadou Eiba, president of the Gambia Cyber Security Association, explains how hacking is done and advises people to be more vigilant.
So it's a job for some people. Hacking, basically, we have what we call the ethical hacking and also the malicious hacking. The ethical part is where you try to protect the integrity of the organization. And in doing so, it means you need to have some basics and understanding of hacking, meaning also you need to understand how the criminals, hackers, how they think, how they behave, what's their motives. So those are the ethical hackers. The malicious ones are the ones that hack into systems unauthorizedly, do you understand, thereby paralyzing the entire infrastructure or holding an organization into ransom or an individual to ransom, thereby requesting for a pay.
Sanusi Drame, Principal ICT, Ministry of Information, Communication and Infrastructure, highlights some procedures the Ministry of Communication has taken to eradicate cybersecurity-related issues in the Gambia.
Okay, the strategy plan lays down some of the recommendations that need to be put in place, or the measures, but there are specific legal instruments that that details or expounds on these specific recommendations.
A cybersecurity expert who wishes to remain anonymous says we should ensure our phones are locked to ensure no one else will have easy access to it. He further advises that people should have multiple passwords, as it is unadvisable to use a single password to log in across many accounts. According to him, with the advancement of technology, there are measures to stop cybersecurity. Those who want to hack will always keep trying so. We are not completely safe. However, if we are warned, we can be vigilant, and together we can stop cybersecurity. For Qtv News, I am Farisi Sanya.
Coming up next is international news. Malawi's President Lazarus Chakwera has released a statement confirming the appointment of several new ministers in a rejigged cabinet after the old cabinet was dissolved over corruption scandals. More in this report.
With several reports of grave and serious corruption allegations against some key members of his cabinet making rounds on social media for weeks, the president dissolved cabinet in a move widely welcomed by Malawians. This development follows a presidentially sanctioned investigation into some of these allegations. Chakwera dissolved his entire cabinet, saying some ministers as well as other public officials had to account for allegations made against them. However, the investigation does not appear to have addressed allegations involving the president, especially claims of nepotism. In the new cabinet, Samuel Kawale was made Lands Minister, Vera Kantukule, Labour Minister, and Mark Piri, Trade and Industry Minister. Abida Mia was given the Water and Sanitation portfolio. The reconfigured cabinet excluded Lands Minister Kezi Sukua, who was arrested last month in a bribery case. He is accused of benefiting from land deals involving a UK-based Malawian businessman. Meanwhile, Labour Minister Ken Kandodo is accused of diverting COVID-19 funds, and Energy Minister Nutin Kambala was accused of meddling in the awarding of fuel import deals. And in a cautionary note, the ECM and Assembly of Malawi's Catholic bishops said authorities must ensure that no one is pressurized, intimidated, or influenced in the pursuit of justice. The president had been facing increasing agitation from within the opposition coalition, with many of its members accusing his party of corruption, nepotism, and pushing the country to the brink of an economic crisis. His decision, however, came close on the heels of the arrest of 3 former officials of the former governing party, Democratic Progressive Party, which included the former finance minister and central bank governor, touted to be his prime challengers for the election scheduled for 2025. Answane Sonyasi for Qtv News.
Now, before we end this news bulletin, let's have a recap of our main news headlines. Hundreds of Gambians in Fonyi Kansala have fled their villages around the border with Casamance following heavy gunfire during clashes between Senegal soldiers and the MFDC rebels. Over 200 countries have collaborated and MRC the Gambia to produce data on antimicrobial resistance, which causes 700,000 deaths per year, according to a 2014 review. At the annual data presentation and award ceremony held on Thursday, the Bundung Maternal and Child Health Hospital registered 3 maternal deaths in 2021. We heard from experts and individuals about cybersecurity, which has become a big global issue, especially in Africa, where cybersecurity measures appear weak. In international news, Malawi's President Lazarus Chakwera has released a statement confirming the appointment of several new ministers after the old cabinet was dissolved over corruption scandals. That's it for QTV News, and thank you very much for watching. Join us again tomorrow for more news.